And good morning and welcome. And I am Dr. Peter Holmes, orthopedic surgeon, and I am host of your program, Ask the Doctor. My guest this morning is Dr. Albert Mosqueda. Dr. Mosqueda is an internist or internal medicine specialist. If you have any questions for Dr. Mosqueda in the future, there's two ways to reach us. You can either reach me through needfoundation.org or fax 696-9012. I'd like to read a couple conflicting articles on access to drugs for seniors. And of course I have my opinions and I always like yours. First one is DC residents can't sue for high drug costs. An August federal appeals court decision struck down a Washington DC law aimed at controlling prescription drug prices. The U.S. Court of Appeals for the Federal Circuit ruled unanimously that the District of Columbia's Excessive Pricing Act violates federal patent laws. The statute would let residents sue a drug manufacturer if a judge determined the wholesale cost of a drug exceeded 30% more than that of the costs in Canada or Germany. Okay. Folks, whose drug is it? Who owns that drug? Okay, let's look at a widget company. Widgets are pretty useful. I don't know what a widget is, but you get the idea. So you have a widget company, and the widget company decides to make a widget. Now, they come up with the idea to have the widget. They design the widget. They test the widget. They spend the money, and they end up with the widget. Now, once the widget's out there, it's their widget. They should charge whatever they want for that widget. Now, they can't charge a whole bunch because nobody would buy it. And they can't charge a whole little because they wouldn't make any money. But that's where the business comes in. It's theirs. It's not the government's. It's not your drug. It's not your widget. It's theirs. You have the option to buy it. See, the companies have a responsibility, number one, to their shareholders. They also have a responsibility to their self-preservation. In other words, they have to make sure that they generate enough income to preserve themselves as a company and go forward. They also have a responsibility to take care of their folks out there because that's their business and they can't look that mean, so they do help along some of those lines. But it's their drug, it's their right, it's their business. Now remember, a drug that came out like Celebrex, which I use quite a lot, cost $720 million before it hit the street, okay? And they weren't sure it was going to hit the street. Who took the risk? The drug company took the risk. They took the risk, not the government, not you. They did. And certain things like Vioxx came out, they spent $550 million on Vioxx, and boom, it's gone. Bextra, boom, it's gone. Reslin, boom, it's gone after $500 million. Did you pay for that risk? No, they did. It's their drug. Now this part about 30% more than Canada. Canada subsidizes the cost of their drugs to their people. So it's artificially low. It's paid for by their taxpayers. They think they're getting cheap drugs. They're not. They're paying for it by taxpayer money. But it's 30% on top of a subsidized price means the drug manufacturer is being forced to accept less than what they want to charge for their widget. I will point out this. When it comes to profits to drugs companies, the federal government gets about half of that profit. You know, they get half of the profit when it comes to oil. I mean, the government's got a great business going. Government doesn't drill any oil, but they get half the profits. Why? They get corporate tax, which is about 33%. Hello. And then when they distribute dividends to their shareholders, the dividends are taxed. It's a double taxation. They end up with 50% of the profits. They're not going to cut that out. Now, one other article, I think it conflicts a little bit. Medicare imposes limits on anemia drugs. Medicare officials last month decided not to go as far as they were in limiting coverage of key anemia drug for cancer patients as they initially would have. Here's the rules now. Anemia as a result of chemotherapy for solid tumors, multiple myeloma, lymphoma, and leukemia can be treated. But if the anemia is caused by the cancer itself, you can't use the drug. Number two, patient's hemoglobin has to be less than 10. That's what the government says before the physician is allowed to use it. In other words, no judgment on the part of the internist or chemotherapy doctor. It's up to the government to establish this. Okay? The physician stops treatment after 4 weeks if the hemoglobin level is 10 grams or higher. They also have dose restrictions. You have to start at 150 units 3 times a week, period. So, other things, if a patient has a hemoglobin problem because of their chemotherapy, Chief among the disagreements are the approved starting and ending points for anemia. Medicare will cover the drugs for chemotherapy patients only if their hemoglobin levels are less than 10, but not more than. So in other words, here's the deal. They're getting down to 10.1, you can't treat them. 10.1, now they come in 9.8, 9.7 the following week. You should have already been treated, but now it's proven, now you can treat them. Now they start getting back up. Now they're 10.4, 10.5. You got to stop treating them. In other words, the government's got their window in there. Now, if you're a male and you're used to a hemoglobin of 14 and now you're running 10.1, you're out of luck. This is the problem when we turned over our Medicare trust funds and let them spend it in the general budget. They never saved the Medicare trust fund, so the money's not there, so they don't have it to spend. That's not your fault. But look at it this way. On one hand, they want the private drug companies to take it in the shorts and decrease their profits by having a limitation on their drug. On the other hand, an approved drug that works for everybody, if you have anemia from myelodysplastic, you can't get treated, but you should. On the other hand, they don't want to spend the money when they have to take it in the shorts. Which way should it be? These are my opinions. If you have any comments, of course, there's two ways to reach me. You can either get on my new and exciting web, needfoundation.org. It goes through my charity foundation. That's needfoundation.org, or 696-9012 to ask the doctor.